Hi everyone. Good evening, everyone. My name is Tin Mawin, Research and Development Manager from Bana Institute, Myanmar. Nice to meet you all. Good morning to Henry, who is also joining this from the US in early morning hours. Thanks a lot, Henry. For those joining from Myanmar, I hope you all had a good working day. Thanks for joining us in such a kind of after work Zoom meeting and showing your interest for our information session regarding this health equity research training. I will share our agenda today. This is our agenda today. And also, I would like to tell you a few housekeeping themes, please mute your microphone if you are not speaking. Also, we will have a separate, this number 4 question and answer session. And so we will attend all your queries. And so, yeah, without further ado, I would like to request Henry for giving a welcome speech first. Yeah.
Okay, great. Thank you very much. Let me share my screen. Okay, very good. So thank you for that introduction. And I'd like to welcome you all to this Zoom meeting. Thank you very much. And we're here to talk about equity research in Myanmar. And this program is being presented by the Global Ethics Education Initiative and also the Burnett Institute, as well as other academics from Myanmar. And so you've already seen this agenda. So why equity research? Why are we focusing on this? Well, due to the COVID-19 pandemic and other disturbances to the health sector, there is now strong evidence has emerged of its disproportionate impact on vulnerable groups, leading to health inequities. Such vulnerability may be associated with population status based on ethnic origin, race, citizenship, internal displacement, stigmatization, poverty, and pre-existing physical and mental conditions. So I just like to briefly explain the difference between equality and equity. Here we have a photo, and everyone here you could see has equal resources. So that's equality. However, you can see here that this person here is standing on lower ground, and that represents systemic differences or systemic social differences amongst groups of people. And these systemic differences are avoidable, and that leads to inequities. And for example, faulty policy decisions that have increased some of the barriers to access to health services faced by the poor. So again, even though there's equality, there's inequity here. And in order to address the inequities, we have to give some vulnerable groups more resources in order for them to have equal chances to health and other things in life. So essentially, equity is the absence of avoidable differences among groups of people. It has become clear that a better evidence-based approach to health policy is needed with equity at its focus. Essentially, equity is a solution for addressing unjust, imbalanced social systems. So for that reason, we have developed this health equity training program because there are health inequities that vulnerable groups face in Myanmar, and this requires the conduct of research to address and mitigate these inequities caused by the social determinants of health. And in order to enhance, so this program, the goal is to enhance the capacity of academics in Myanmar to conduct research addressing inequities. And that's why we have developed this program. Essentially, the focus on health equity research will require investigators to propose projects that develop and evaluate evidence-based solutions to health differences that are driven largely by social, economic, and environmental factors. So essentially, this program is designed to enhance the capacity of investigators to propose projects and conduct research addressing inequities. And this one-year training program, the aim at the end of the year is for investigators to propose, conduct, analyze research that addresses inequities. So this slide reminds me, I have only 3 to 4 minutes to talk. And so I will stop now and turn the Zoom meeting over to Dr. Phone. Okay. Thank you very much. All right.
Okay.
Stop sharing?
Yep.
Good.
Okay. So thank you, Henry. Yes, good evening for everyone. I'm Dr. Phom Yu Win, country representative of the Bane Institute, Myanmar. So thank you very much for your precious evening times and your interest in our training program. I hope this information session is useful for your consideration, decisions, and participation in the coming our training program. So the topic and the course structure of this health equity research training is relevant, feasible, and applicable for all of you. So because it is relevant, particularly for this our country times and our country context, and also for the benefit of the vulnerable population for whom your program are providing the health services. And this training program will be conducted online at the out of office hours. It will not take not too long. It is a 1 hour per week webinar followed by the synchronous learning platform and on-demand video. So this is feasible for the participants who are also working full-time at their primary job. And so you can also make the practical exercise over the whole training course period. Particularly in the later part of the project, there will be the exercise to conduct the research project. So one of the important points is that the training program, tuition fee is free. And this application process is not complicated, but simple, but something complicated to attend this, to participate in the training courses. And you can apply this knowledge and skill gained from these training courses not only during the training, but also after training also. For example, you can embed your research component into your existing or your new project. And if you look at this faculty members of this training teams, so there's a collaboration between a high quality technical expertise with the local context knowledge. So the teams, the trainer teams, I mean that trainer teams is composed of this research equity specialists, research ethics specialists, statistics specialists, and then scientific writing specialists who based in the United States and Myanmar. And also that they are also working at the national level, regional level, and global level for the moment. So the whole discourse will be led by this Professor Eligibility, who is this program director of the Global Ethnic Education Initiative, GEEI, and he is also the faculty director and the professor of medicine, University of Maryland also. In summary of my introductory talk, so this training program is the certificate program course over 9 to 12 months on the 6th module taught by the high quality faculty members. So today's information session will give you the course overview and some detailed information and interactive question and answer and navigation for the further information and process. So please enjoy it. Thank you very much. Yes.
Thank you.
Thank you. Thank you, Dr. Phom and Henry, for welcome speech. Without without further ado, I would like to request Dr. Juju Tan for explaining about the program. Maju, yeah, I will share the screen for her.
Yeah. Hello, everyone. Apart from Henry, majority are Burmese that I'm seeing in the participants. So I think good evening to all of you. And thank you so much for showing the interest in this health equity research training program, which is collaborated by the Global Ethics Education Initiative and Burnett Institute Myanmar. I am the research director for Burnett Institute Myanmar. And while reading some of the names on the participant list, I do know a lot of, I seem to know some of the people, and it's really interesting that a lot of people are attending this health equity research training in starter or our introductory program. So actually this program, next slide please, Madam. As Henry have already highlighted, the COVID-19 pandemic and other disturbances around the world have affected the health sector in many ways. And there is a disproportionate impact on vulnerable groups, leading to health inequities, especially among the poor, less educated, urban, poor, rural areas, ethnic minorities, and a lot of the inequities are happening within these vulnerable groups. And Myanmar, a country with a twin crisis and a fragile health system, is of no exception in facing this health inequity as well. Next slide, please. So the health equity research is, it's really a need, because we really need to uncover the hidden patterns of avoidable inequities, to assess its impact on vulnerable groups, and to design and implement appropriate responses to combat these inequities around not only Myanmar, but around the world as well. So this is a capacity building effort especially for researchers in Myanmar. And we really aim at not only international or national, but we also would like community-based organization to be taking part into this collaborative research, addressing health inequities, which is very essential and timely at the moment for Myanmar. Next slide, please. So as already said, it is collaborative between Global Ethics Education Initiative and Burnett Institute Myanmar, with the leading experts in health equity and global health. Like you all might know Dr. U Tan Tun Sehing, who is a very pioneer in health equity research in Myanmar, and he has so much knowledge that we can learn from him over the past various governments and various decades that he has worked within ministry and outside the ministry, globally and internationally. So he will be one of the main persons who will be also shaping this research program. So this is a one-year certificate program, and we really have to thank to Henry, who has really put effort in waiving fees for this inaugural program as a starter. And with this one-year program, we will be only like giving you some of our knowledge, but we will also be gaining knowledge back from you as participants and as trainees. We will be also learning back a lot from you guys also. Next, please. So it will be a total online course, which will start on October 2nd, 2022. And there are two parts. Part one is a weekly 1-hour virtual webinar and a synchronized learning on a platform called Moodle, which will be talked to you more about. And it will last until March 31st, 2023. Part two actually is a research project. While you're learning within the Part 1 program, we aim that you will be producing a protocol that you can be really conducted and implemented as a research work within the second part of the program. And we really aim for you to be analyzing. And at the end of the program, we really want you to be utilizing this training program and your research output, not only for your organization and yourself, but also for to reduce inequities in Myanmar. Next slide, please. So the topics that will be covered in this course are foundation of health equity research, developing a research questions, because we put this very early, because by end of the first program, we would like you to be producing a protocol which is related to health inequity. And we will be introducing to you both quantitative, qualitative research methods, how to do literature review, and how to do some of the analysis using research methodology using quanti, quali, and mixed method. And the fourth module will be covering how to engage with the community in your research. And the fifth module is strengthening health system to advance health equity. And then we will be also having a sixth module. Sometimes it will be entwined into other modules as well, is scientific and grant writing, just to shape your proposal into a real proposal that may or may not be getting into a grant type of proposal. So we will be really tailoring you to write a proposal that would be useful. And then to conduct research, that is to really implement the research program and to analyze your findings, and then at the end of the day, to be utilizing it to reduce health inequities in Myanmar. Next slide, please. So I think this is a certificate program, and main program coordinators are Dr. Zeya Sui and Dr. Timawin. And you can also go online into looking at the program. We have put into our what will be taught in every program curriculum type of thing. But we are, as we go along the program, we will be really learning from you, and we will be updating some of the training materials with updated materials as it comes in. Next slide, please. So this is, as I have said, this is a really hands-on practical health equity research training program that I hope that it will be useful for you all. And we really would like to hear some of your questions and answers, and we will try our best to answer most of them. Yeah. Thank you, Mother.
Thanks, Matthew, for giving the introduction about the program. And also, I would like to invite Henry request to explain about the application process as well as the eligibility criteria about the program.
Okay, great.
Welcome,
thank you very much.
The floor is yours.
I'm learning so much about this program myself. Just kidding. One point I like to stress is that there'll be weekly 1-hour webinars. However, the commitment to the program also includes the asynchronous activities on the Moodle platform, which will include readings, videos, handouts, and also weekly activities that could involve addressing a small case study. We'll have you also work in groups, and also there will be a discussion forums through most of the week. So essentially, the applicant needs to expect to spend about 2 to 4 hours a week on this program, not just 1 hour, not just watching a webinar, and we'll tape the webinar so that the webinars will be on demand, but 2 to 4 hours a week, probably closer to 4 hours a week to devote to this program. And I thought I had something else to, oh yes, and I will give an introductory session on how to access the Moodle platform, download resources. So essentially, I'll give a sessions on how to do online training. Now, with that, what are the what's the application process? So let me show my screen again, and let's see. Right. So here's the website, and we'll send you all the link if you don't have it already. And again, the application deadline is September 15th, and the program begins October 2nd. And this slide shows the eligibility requirements that we have here. Essentially, we're requiring the applicants to have a bachelor's or master's degree in a related health discipline, recent conduct of health-related research. This is preferred. If you haven't conducted research, that's okay, because the aim of this program is to build capacity in doing research, also building capacity in writing as well, as you heard before. And actually, the end product is to do a research project. And also, I don't want to omit that we would help you publish that research as well. Other requirements: relevant work experience in health, good English communication and writing skills, commitment to this program for 1 year, and hence applicants should seek their respective organizations' approval to join the training and conduct the research. As was mentioned before, these webinars will be in the evenings, not during the work time, but you should seek approval for your directors in order to join this training and conduct the research. So the application submission, as mentioned before, is very simple. On this website, you go to the application form here. And this is an online application process where you fill in some basic information about yourself, professional information, educational background, description of your work experience, research experience. And then we would, with your application, we would like you to submit your CV, no more than 5 pages, and also a 1-page personal statement explaining how this program will advance your career goals. So again, the online application process, submit a CV and submit a 1-page personal statement, and you submit these 2 documents online. We hope that this will be an easy process, and we look forward to receiving your applications. Okay, I think we're up to the Q&A.
Yes, Henry. Before taking questions from the attendees, I would like to present 2 questions we received by someone who during their registration process. This is about what kind of statistical software are we going to use. So, would you like to answer, Henry?
Oh yeah, sure. Good. Very good question. We will make available the SPSS software. My program will provide the fees for a 1-year license, and we will give instruction in how to use SPSS, and you'll have access to the SPSS for 1 year. Okay, good question. Thank you.
Thank you, Henry. And another one is like, what kind of certificate are we going to receive? that one of the registration, attendants asked.
What kind of what? I'm
certificate.
sorry.
Certificate.
Oh, certificate.
Yeah.
Good. Very good question. One, the certificate will be in color. No, just kidding. This program is accredited. International accreditation with continuing education points. The Global Ethics Education Initiative has the I'm searching for the word, has the ability to provide international accreditation, and that will be on the certificate as well. So any other thoughts about that question?
Thanks, Henry. The certificate, I think this is really great for the certificate. We have already explained. And there is another question in the chat box. How about if we have a poor internet connection? Can we study missed lectures?
Well, the short answer is yes, because the webinars will be recorded, and you could view them on demand. As I said before, we all lead busy lives, and sometimes you won't be able to attend the live webinars. Everything will be online. You could access the program anytime, anywhere. So poor internet access should not be an inhibitory barrier for this program. Thank you for that question.
We also received that how much is the fees. I think we have already mentioned in the program. It is not for this inaugural program. The fees will be waived, so you do not need to pay for this anything for this program, this year program. Yeah.
Good question.
And another one is like, is there any seat limited for this course? So as far as I remember, it is 15, I think, Henry.
Yes, right.
Yeah. We were limited to the seat for the 15 people for this course. And one attendee is asking, is it 1 hour every Sunday morning or evening time? I think it is evening time, because to accommodate with Henry's time.
Right, exactly. So did we decide on Sunday or Monday? Did we actually make a decision yet on what day of the week?
Yeah. Also asking what kind of research type should attendees conduct, quantity or quality? This hi Catalia, this is also Dr. Jujudan already mentioned. We can have quantitative method or qualitative method or mixed method. So or depending on your research questions. Yeah.
Right. And having said that, due to existing circumstances, we're gonna promote the conduct of secondary research, and we'll have a session on secondary research. It just might be easier to do that type of research, but we could discuss that more. We'll be teaching about qualitative and quantitative research for sure as well.
And another question is, Henry, approval letter. So from the organization is needed, whether the approval letter from organization is needed. If so, how to attach this as a separate one? So he is asking about the approval letter from the organization letter. So we only have the attachment is only 2 attachments. So is there any? We should put another document for organizational approval letter, Henry?
Good question. One, you could attach as many files as you want on the online submission. Having said that, we're not requiring an actual approval letter, but we are recommending that you seek approval from your director of your institution, just to let him or her know you're doing this type of program.
Dr. Minkoko is asking, can non-INGO public health professional apply to this program?
A non-INGO or non-NGO, I think the short answer is yes. And so we're trying to open this to, we believe in equity, and so we want everyone to have access to this program.
Another question is are there any relation to any of the university program?
You mean university program in Myanmar?
He didn't mention anything about that, but is asking any relation to any of the university program.
Well, the short answer is no. This program is not related to any specific university in Myanmar.
Thank you, Henry. And also, Dr. Gangsa-Ang is asking, to my knowledge, the attendees will be conducting a research after and or during the course. How will data collection be done for the research? Will there be any fee survey or investigations? We are, Henry, we are doing the secondary data analysis. Although we are delivering the research method, including quanti, quali, and mixed method research approach, but because of the situations, we are going to for research for this course, or if you are doing the when you are doing the research, it is the secondary data analysis, right, Henry? Would you like to add anything for that?
Sure. Well, everything here, I'll use the phrase, is a moving target, meaning that if one is able to do qualitative, quantitative research that will require the prospective collection of data, will assess on a one-on-one basis. And if one is able to do prospective research, we will provide any funding needed to do the research project. I think that answers the question.
Yes.
Okay,
just to add, maybe just to add to that, Henry, because it's only a one-year program, we were really thinking of, we really are thinking of the participants. We were thinking of participants from side more. So the first priority is to do secondary data analysis from your organization if you could get access to the data. Second thing is you could do qualitative data collection if it's permissible and if you are capable of doing it. And in that case, with your research question, if needed, some of the funding can be provided by Henry to do the qualitative research. The only thing we are worried about is because it's a short timing program, when the data collection might be so long, we really were thinking about the participant, but it is not limited that you cannot do data collection within this program. It depends on you and the participant's organization on allowing that participant to do that. So I'm also seeing another question on the web saying that about the peer review paper submission. At the end of in the last course, we will be helping you to analyze and write a paper to be published. So it usually takes about, in the sorted course, in the analysis phase, we try to finish the paper as the course ends. But it depends, sometimes it depends on the participant that we may need to go on a little longer. And sometimes when submission, you may not be accepted to an article immediately by a journal. So sometimes it takes a little longer than what we expect to get accepted by a journal. So sometimes that process it's a little longer. That's why when you look at the coursework, it's between 9 to 12 months, because when you finish and submit the whole article, it may take a while for you to get accepted. I think, can you clarify more Henry, please?
Yes, I appreciate that question. And about milestone 4, we will correct that. There is no requirement to submit a paper to a journal within 4 weeks of the end of Module 3. So we will correct that. Essentially, we want you to conduct the research, and hopefully by the end of the whole program, we will help you submit, we will help you write the manuscript and submit it to a journal for publication. Let me just say that that will not be a requirement to get the certificate, okay? We all know we're all very busy, and hence, if you have the time, the effort, and all that, we will help you write the manuscript and submit it to a journal. But again, that's not a requirement to get that certificate. Another question I'm seeing is, can a person with a non-medical background join the program? And the answer is absolutely yes, okay? Again, we're promoting equity in building capacity in doing research, but good question. Thank you very much. Someone has their hand raised.
Yeah, I would like to ask a question. Thank you, first of all, thank you so much, Sia, Ahmad, and all of the responsible persons. I would like to know that this program is especially designed for the working person. So I would like to know all of the study time and the working for the thesis time will be out of the working hour. I hope so. So because as you already discussed that there will be at least nearly 4 hours but a week, including the webinar time and also the activity and something like that. So these 4 hours will be out of the working hour or during the working hour. That is my first question. Another one is all of the support person, suppose that mean the professor will be the service specialist, and the who teaching the participant will be also available at the out of the working hour. So I hope so. So these are true one my question. Thank you so much. Over to me.
Thank you for those questions. In regards to your last question, there will not be any activity during the working hours. The webinars will be in the evening, and this is the beauty of online training. Again, you could access the materials at any time and anywhere. So this will, again, not interfere with your working hours. Okay.
Okay, thank you so much, Henry.
Good.
Yeah.
Could someone repeat? You had another question? I'm just not remembering it.
Another question is, do we have plan to increase the number of participants? I mean, trainee participants. As you can see, there are more than 50 participants even in this sharing session.
Well, I love to have such a question that demonstrates the interest in this program. Because I don't like to say no, I'll say maybe instead of no, but this is the first year and we don't want to overload the program. However, there's always next year, okay? And we aim to for sustainability for this program. We want this program every year. And first year, the fees are waived, and there's a good chance that the second year, the fees will also be waived. But after that, to have a sustainable program, we may have to charge some fees. If you don't have a chance this year, there's next year. Okay. Dr. Wynn, you have a question?
Dr. Wynn, please go ahead. Yeah.
Regarding the number of participants, I just want to compliment Henry. Of course, we have the limitation in the capacity of the course moderator, because as Henry and Dr. Jutan already explained, then it will not be the whole coursework, because it will be more like half coursework and half research work. So when you do the research, then the moderator or the course instructor have to support you for your research, whatever you do, the quality or quantity or the secondary data analysis. So we have limitation in the moderator in this year. That's why we have to limit the participant, because we want both the quality and quantity. So that's why we have to limit. I really appreciate your request to increase the number, but we are trying our best maybe in next year. Thank you.
Thank you. I see a question about, is it a first come, first serve process? So this is a very interesting question about allocation of scarce resources. And the short answer is that it's not first come, first serve. We have a selection committee who will review the applications and make a decision about the first 15 participants. Another question concerning conducting the research jointly with another person, and I take it a person who's not part of the program? And the short answer is yes. We believe in collaboration. So if you have a partner outside of the program, the answer is yes. Good question. These are really good questions. And we will make this presentation. We're recording it, and we'll make it available on the online site, and we'll also make available the PowerPoints that are being shown here. And also, well, since these questions are so wonderful, we'll have answers, written answers to these questions.
But you raised your hand?
Yeah, because Dr. Danton Singh is here with you all. As I've already told you, he's a pioneer in health equity research in Myanmar. I would like to call upon him to say a few words. Is he still here with us?
Yes, Matthew.
Yes, please.
Sorry, thank you for your invitation, but especially I've made a special request to Bernard through Mathema Wen, that because I do not belong to Bernard, neither the Bernard Institute nor university, but a special moderator or facilitator in the team. So I do not want to make any answer. These are more or less related to management of this program, right? So I requested just people from Bernard and Maryland University to respond back to the queries that are posed by these guests, but these people attending this meeting. That's why I was just trying to be silent. But I noticed that there are some of my good friends, actually they are all junior colleagues here attending this meeting, and I'm so glad for that. I'm giving this individual chats from them. Thank you very much. Thank you very much. I don't think they have any question to ask me. I don't think so. So I would maybe post against.
Let me share my screen for a second. And I just want to, on the website, we have the faculty tab. And if you go there, you'll see yours truly, by research equity specialist, Dr. Danton Singh, Kuku Tan, and Dr. Win Han Oh, research ethics specialist includes myself and Dr. Walkbright as well. Statistics specialist, Dr. Thinmon Win, and scientific writing specialist is a colleague from my university, Dr. Isabel May. So we just want to show the wonderful faculty that will be teaching this program and also providing mentorship for people doing their research.
Thanks, Henry. If you have any questions, you can unmute your speaker and can ask in person as well. I think all questions have been asked and attended.
Yes, and if you think of any other questions, we'll provide our emails, and we'll send a letter out to all the registrants, providing links to the website, and also an opportunity for you to email us back any questions whatsoever about the program, also about the application process. If you're having problems accessing the online program, please send us a message as well. So any questions that you have, again, the deadline is September 15th. So please be mindful of that, because we're thinking it'll take us about 10 days to make the difficult decision of who to accept into this program. Okay. Any other remaining thoughts from the participants, the faculty? I am just really excited that we're starting this program. It's been at least 6 months in the making, in developing this program, and we're all excited to finally present this program to people in Myanmar. And I want to thank all the faculty for their hard work. It's been a real joy and pleasure working with everyone, and I look forward to this next year, working with all the faculty and also all the participants.
There is one more question. When will we know if we are selected or not? So it's a result, when the result will be out.
Well, that's a good question. And I don't want to answer that because I don't want you to hold me to that specific date. Okay. Don't pin me down. And all I can say is as soon as possible.
Probably before the October 2nd, right, Henry?
Oh, yes. Right. That's a better answer. Before October 2nd, okay? I could guarantee that.
And there is one question, like, can people from non-medical background participate in this program? He didn't hear earlier due to the poor internet connection.
Right, and the short answer is yes, absolutely. Okay. So we welcome everyone with the interest.
Okay, is there any other questions? If you have, if you have the questions after this event, also you can you can submit to me, tema.win@bana.edu.au or Dr. Seyasui. Yeah. So also we have upload during your in our email also it is mentioned, and also in the memo also we have submitted how to submit, how to apply, also if you have the queries you can also ask that also. Yeah. And so if there is no more questions from anyone, I would like to request Dr. Paul to address closing speech for that event.
Yes, this is not the closing speech. This is only the thanks, lots of thanks. Yeah. So because the thank you very much.
No more speeches.
Yes. Thank you for your joining this information session and your attentions on the presentations, and also your active participation in the question and answer. I'm very glad to see that you all enjoy the information sessions, and I hope that you obtain that this is a useful information about the course, so about the application process and the suitability of the participant. So the next step is that please decide within your organizations and you yourself or your colleagues make the application and join the training course. So I'm very much looking forward to working together on this training course. So thank you very much and good evening or good night.
Okay, thank you very much for those closing remarks. Thank you all.
Thank you.
Thank you, everyone.
Thank you, everyone. Bye-bye.
Have a nice day. Bye-bye.
Have a good evening.
Bắt you. Okay.
How's ya?
Hòa lý, đang nắm mà phong xe lại mà ra. Lý gì à?
Ok, hóa xả. Ok, hóa xả lại bảo. Tôi mới xả lại bảo mẹ xả.
Thanks, Henry.
Thank you. Thank you.
Thank you, Henry. Have a nice day. Bye-bye.
Okay, bye now.